Welcome to the next episode of the Betterwallet Podcast. Today is a really important episode because we're going to be sitting down with Jared Walker. Jared Walker is the founder and owner of the nonprofit $4, who is helping people pay off medical debt. As simple as that, right? So, as we know, medical debt is a huge problem within the United States, and it's crippling a lot of people. A lot of people have debt that's in collections, right? It could be on your credit report. It can kill your credit score, right? And why I thought it was important is not only because of those reasons, but because of personal reasons. I have family members that have plenty of medical debt. So the fact that he has a nonprofit that is helping people pay off medical debt is huge. He has helped consumers pay off close to $26 million in medical debt, which is a lot of effing money, right? So I wanted to make sure I brought him on to the podcast to teach you how you can go about paying off your medical debt through a couple of services that, frankly, aren't really talked about as much. So during the episode, you'll learn a few different things. You'll learn if you might qualify for medical debt relief. And if you qualify, what steps do you need to follow in order to get that debt relief? And then also how his nonprofit, $4, is helping people like you go about getting that debt relief so you can live the life that you truly deserve. So I'm really excited for this episode. And for anyone who's saying, hey, look, I don't have any medical debt, but I need to pay off my personal debt, be sure to download my free financial checklist. I have it in the show notes. That checklist has everything in there that I wish I knew when I first started making my first dollar. So I encourage you guys to go download that checklist. If you do not have medical debt, if you have consumer debt, credit card debt, auto loan debt, whatever, student loan debt, given that, a lot of folks have to start paying back student loans as of, I believe it's coming up in the next couple of months. I forget the actual date, but make sure you download that checklist if you need a roadmap on what you should be doing in order to get your finances together. And with that, let's get into the episode. I can't wait to teach you how you can go about paying off your medical debt if you qualify.
Welcome to the Betterwallet Podcast, a podcast where we talk to everyday people who have changed their lives through managing their money. We talk about their money journeys, the good, the bad, and the ugly.
Welcome, everyone, to the next episode of the Betterwallet Podcast. As you guys know, the Betterwallet Podcast is all about demystifying the topic of money and sharing powerful money stories from people who truly beat the odds. Today, guys, I know I've told you guys that we've had like some special episodes where people come in, they give their story. We talk about, certain topics related to money management, investing, even real estate. Today, we have Jared Walker on the line. And why Jared is an important person is because he operates this nonprofit called $4. You need to know about this nonprofit, especially if you have any type of medical debt, right? So we all know medical debt in the United States is a big problem that we don't talk enough about. I was doing some research before the actual podcast episode. The United States alone, we have between 81 and $140 billion in medical debt in collections. And that was from the Federal Consumer Financial Protection Bureau, right? Billion, right? With a B. Jared operates this nonprofit, again, called $4. They're specifically dedicated to helping people pay off medical debt through programs that we'll talk about during the podcast episode. And we're talking before the actual recording, and let me make sure I got the number right. Their organization has saved people $26 million in medical debt, which is staggering. And I'm just really excited to talk about it, if you can't tell. So we want to jump in. We want to talk to you about the actual nonprofit. We're going to talk to you about how you can go about getting your medical debt resolved. And we're going to ask a bunch of questions about this program that I feel like the country doesn't know anything about. So welcome, Jared. Welcome to the Betterwallet Podcast.
Thank you so much for having me. Appreciate it. Thank you.
Absolutely. So one of the reasons on why I have Jared on the line is not only because he has a really good nonprofit that's completely killing and saving generations of people, a lot of money when it comes to medical debt. One of my good friends, Chloe, reached out and said, you have to get this guy on the podcast. We need to get more and more people learning about this nonprofit. And I was like, Chloe, who can this person be? Like, you called me, like you're not texting me. You actually called me, or you're talking to me about this person. And once you told me, I was like, yeah, like I'm dropping everything. I'm getting him onto the podcast. So I'm really excited to jump in. But before we jump in and I start asking you a bunch of different questions, I have to stick to what we normally do on the podcast. And there was an icebreaker question. So I did not prepare you for it. So good luck.
Perfect. I'm
So
ready.
the question is, and I love asking this question because it really gets at the root of like who the person is. If you had to delete all the apps from your phone, but you can only choose one to hold on to, which one would it be? You can keep texting and calling. Like you got those two. So what would be the third?
Oh man, that's a great question. What would I
And it
keep?
can't be the Starbucks app.
No, I don't even
You're
have
so
the
close
Star. I don't even have the Starbucks app. I
now.
mean, it'd probably be email.
Email.
It'd probably be my Gmail, right?
Yeah.
That's so lame. That's such a lame answer. It should be like a wellness app or something. It should be like meditations or something.
Like a Calm app. But no,
Yeah,
I mean, really, it speaks to, again, it speaks to who you are as a professional, right? Like you mentioned before the recording, you went from, one person, now you have 13, 14 people across the country, all focused on helping people pay off medical debt. So the fact that you use those three apps, that's, your bread and butter. I mean, that's really important. So it's all good. No wrong or right answer. I'm sure I could probably think of some wrong answers, but as of right now, there's no wrong or right answer. So let's get into it, right? Let's talk about the charity or the nonprofit. How did you come across this nonprofit? How did it all start?
yeah. So I started this organization after watching my own family go through a medical crisis. So my wife and I were sitting at home. This is 2012,
Mm.
so a while back. And she got a phone call. Her aunt had passed away from cancer. And a couple of minutes later, I got a phone call, and my cousin had gone into labor, 7 weeks premature. Baby needed a heart surgery to live. And it was like same day, same hour. Both families are hit with these medical emergencies, right? And I think I'm talking to my mom on the phone or something, and it's like, gosh, you know, how much is this going to cost? Like, how are they going to pay for it, kind of thing. And that, like, the focus wasn't even like on the health of the family member. It was more so like, oh man, how are we going to pay for it? And that realization that is most of Americans. Like, I was just looking at a stat this morning. 1 out of 3 people just avoid and neglect medical care out of fear of the cost. So it's definitely, that was like my first run in with the healthcare system in America. Oh, wow. Like, you can lose everything if you get sick. And that's just how the system is. And how do I help people in that situation? So I started in Portland, Oregon, doing like a small grassroots crowdfunding platform where people would sign up for these small reoccurring monthly donations. And every month we would pool the money together and we would pay medical bills for people in our community. So it was really, really small grassroots. And that's how it all started.
Wow. Wow. And I mean, for me, I had a mom that had plenty of medical debt because she ended up getting hurt at the job and like they only covered so much. And she had to get a metal rod in her back. And when my family would talk about money, it was always medical debt. We had house debt and credit cards, whatever, but it was always medical debt from that, something that happened on the job that unfortunately wasn't fully covered. So now you went from this grassroots effort to having this larger organization that's helping people pay off medical debt. Can you kind of talk about charity care and like what that's all about? And how did you discover charity care as a way to help people pay off medical debt?
Yeah. So I was at a little networking event kind of thing, and I met this attorney. His name's Eli. Eli was on our board of directors. He was a board chair. Now he's on staff as a general counsel. We met and he was like, "Oh, it's super cool what you're doing. Have you ever heard of hospital charity care?" And he mentioned Section 501R of the Affordable Care Act. And I'm, what are you talking about, dude? So when the Affordable Care Act passed, it required nonprofit hospitals, which is most in America. Most hospitals in America are nonprofit organizations. A lot of people don't know that. And it's like, in order for them to keep that nonprofit status, because they get billions of dollars in tax breaks, they have to prove to the IRS that they are worthy of that nonprofit status. And they do that through something called community benefit. And community benefit is essentially like they use charity care as that like main piece of community benefit. Charity care is free or reduced care for people within a certain income range. So most every hospital in America will have, some type of income threshold where if you meet that income threshold, they are legally required to waive your medical bills, write it off as charity. So hospitals don't do a great job of telling people about this, unfortunately. So we have millions and millions of people that are declaring bankruptcy or on payment plans for bills that they don't have to pay. So when I found out about that, I thought, screw crowdfunding, man. Like, I'm going to start advocating for patients and filling out these applications and digging into these policies because they're complicated and they're not that, like, nothing is standardized. There's over 8,000 hospitals in America. They all have different policies, different applications, different ways of doing this. So started doing that. And in a few months, I got $1 million of medical debt to be cleared, written off for people throughout Portland. And I thought, okay, this is big. Nobody knows about this. How do I get this out there? So I shifted the organization from crowdfunding into like patient advocacy and enforcing hospitals' charity care policies and trying to get the word out. And that was the big shift at $4.
Oh my God. This is wild. And I think the first question that comes to my head, and I feel like the listeners probably have the same question, is how do you know if you qualify? Like, what's a typical income limit for some of these hospitals for you to actually qualify for charity care?
Yeah, great question. And the terrible answer is it depends because every hospital is different. So a typical policy would say something like, if you are at or below 250% of the federal poverty guidelines, you are eligible for free care. And then anyone from 250% to 300% is eligible for a discount, like at a sliding scale. So if we look at 250% of the federal poverty guidelines, so I think federal poverty guidelines is like 14,000, something around there. So yeah, let's see here, 14,580. That is for a single household. And sometimes these hospitals will go all the way up to 300%, 400%. But 250% is $33,975. If you're a single person, you can make just around, $34,000 gross annual income and be eligible for free care at most hospitals in America. If you're a family of 4, that number goes all the way up to like 70,000.
Wow.
So a lot of times people just assume like, I'm not eligible, there's no way I qualify. But in fact, these policies are a lot more generous than other programs like food stamps or Medicaid or whatever.
Right. And then for anyone who's like, okay, well, how can I find out like what that poverty line might be or that federal poverty number? Is there like a specific website, government website that tells you what that is?
So at the beginning of 2021, I posted a TikTok video and this is what went viral. This is like what, blew us up, is telling people, 1, charity care exists. And then 2, like, are you eligible? So I would show people, okay, this is what you search on Google, like find your hospital's financial assistance policy. And then you have to find, 300%, then you have to find the poverty level and you have to compare the number with your income and blah, blah, blah.
Yeah. Walk through those steps real fast. Sorry. I know people go back and listen to a TikTok video, but just for anyone who's listening, who's like, okay, like got it, I might qualify. Jared, walk me through the steps to like figure all this stuff out.
Yeah. First, Google search your hospital name plus the words financial assistance. So let's say, Mayo Clinic financial assistance. And then that should take you to the financial assistance and charity care webpage of the hospital. And then from there, you're going to click on the link that says like full policy. And you're going to dig through, a 20, 30-page document and try and find that poverty level where it'll say like eligibility requirements. And it'll say, we help people at 300% or whatever. And then once you know that number, then you compare it to your income. But luckily, after we went viral, we created a database of every hospital in the country. So we have the financial assistance and charity care policy data for every hospital in the US. And a patient can now go to our website, dollar4.org, and put in their household size, their income, and what hospital. And we will tell you immediately if you're eligible at your hospital.
Wow. That's amazing. Thank you. And guys, like all this is going to be in the show notes, so you can click on the website and see if you're eligible. I mean, this is like earth shattering for me, like in a good way. And another question that comes to my head is like, why do you believe that the country doesn't talk about this, right? Like, why are the hospitals suppressing this information? Like, why is, this not a topic of conversation, after the Affordable Care Act?
Yeah, I think that the simplest answer is money, right? If a hospital can squeeze $500 out of a poor person, they're probably going to do that,
Mhm.
right? So that is like, I think that hospitals have been able to, for the last decade, I mean, this is ACA went into effect over 10 years ago. So in that policy, it's telling hospitals, hey, you have to do this, but there's no like enforcement to it. There's no charity care police. There's no like people that are going and making sure that it's supposed to be the IRS, but they're not doing it,
Yeah.
So hospitals have been able to kind of double dip. They've been able to receive all the benefits of being a nonprofit, get all those tax breaks, and then also not give out the charity care that they're supposed to give, which is the only reason that they have their nonprofit status. And I think that it's just been like a nice time for hospitals the last 10 years to be able to say like, well, we're nonprofit, but nobody knows about this thing. And the only like real requirement for them is to like make a like good faith effort to tell people, which what they have done is like, the fine print at the bottom of your hospital bill that says like, if you need help, call this number. Like that would be their efforts to tell you about it. So it's not easy. You have to find out one that it exists, and then you have to find out if you're eligible. And then when you call the hospital and you say, hey, can I talk to somebody about financial assistance or whatever? Usually it's like, oh yeah, we'll send you a packet in 7 to 10 business days. We'll mail it to you, or you have to fax. Like 90% of hospitals require you to fax your financial assistance applications into them. So it's like they make it hard on purpose. If they can squeeze money out of you, they're going to try to do that. So that would be my short, not so short answer.
It's just incredibly frustrating, and it's very disappointing as well. Like if you have a resource that could help people, not only just the people, but their entire family, why wouldn't you offer it if there's no skin off your back besides profit, right? Like, or they're nonprofit, but I think even when it comes to nonprofits, there's someone benefiting from that nonprofit some way, somehow, right? So it's frustrating, it's disappointing, and I'm very grateful for your organization who's helping people out. Another thing that pops in my head is if you go and you get $20,000 of medical debt just removed. Uncle Sam, a lot of times, is just like, well, like I want my cut. Is there a catch with that? Do you have to pay taxes on any of the money that might have been forgiven?
That's a great question. The answer is no. So it does not count as income, because a lot of people think that charity care is this like pot of money that each hospital has. And then, you got to get to that money real quick before it dries up, because, and every year it kind of resets, and that's not it. There's no cap to charity care. A hospital is going to set its income requirements. And if you are within that income range, they have to waive the bill. We've gotten $50 medical bills waived. We've gotten $500,000 medical bills waived. So a lot of times people think like, what if the bill's really big, or what if the bill's really small, or like, it doesn't matter, because no one's paying the bill. The hospital is writing it off as charity, and they're putting it into their like community benefit bucket so that they can continue to be nonprofits. So no one is taking a cut out of the savings, or you're not going to be taxed on any of that. So, and that's a great question. I think a lot of people, their first reaction is like, this sounds too good to be true. Like, what's the catch? And it's really just one of those things where, like, the catch is that it's all on you as the patient. All the responsibility is on you to find out about this, to navigate these things, to submit it, to advocate for yourself. Like, when in fact, it should be on the hospital. Hospitals should be vetting people for these programs and helping them apply, but it's just not how it works, unfortunately.
Wow. Now, I know you have the website. I know you can go into the website and figure out if you qualify. Now, I did read something about you guys helping out, like offering services. Is that something you still offer for anyone who's like, hey, like I have a very demanding job. I don't have time, right? People come up with a lot of excuses where it's just like you can get 10,000, 50,000, $100,000 just taken care of and removed. But people have things going on. So like, how
Mhm.
do you guys go about helping those folks who are just like, can you help me navigate this?
Yeah, so we are first and foremost patient advocate organization. So yes, we'll tell you if you're eligible immediately, but then if you are found eligible at your hospital, you are given two options. The first one is self-advocacy, where we will give you all the tips, tricks, and tools to do this yourself. There's a little bit of sensitive information that is exchanged, so some people aren't comfortable with that and they want to do it themselves. And typically, they'll ask questions along the way and we can answer those, and we'll send you videos and how to's on how to do that. The second option is full service, where we would actually reach out to you. A patient advocate would say, hey, here's the next step. Let's work on this. Let's fill it out together. Let's submit it to the hospital. And then we will do, calls, checkups, text messages, and all that to work you through that process. Both options are completely free. We don't charge patients for any of this. And I would say probably 80% of people choose full service because, yeah, it's easier. And we always say a medical crisis shouldn't mean a financial crisis. And that is unfortunately the case for a lot of people. But the other thing is the only reason that you have a medical bill is because you had some type of medical emergency. And if you are recovering from surgery or you're going through chemo or you don't have the bandwidth to go through and read 30 pages of hospital policy, information and fill out the paperwork. Like we want to be able to step in and take that burden off of people. So that is what we do. We advocate for patients. And yeah, we've been able to eliminate a little over $26 million in medical debt for people throughout the country and hoping to increase that.
Yeah, that's great. And I'm going to support you guys the whole way through. And as I mentioned before, the recording, I'm going to try to get you on to more podcast episodes for, other people who have podcasts. And because people need to know about this organization, they need to know how they can escape medical debt. And as I mentioned before, like you guys are helping not just a person, not just a family, but you're helping generations of people that if they didn't have that debt removed, they will suffer. They wouldn't have enough money to go and invest into things like, stocks and real estate and all that. So I want to give you your flowers now and just say thank you for what you've done
Appreciate
and
it.
how you guys continue to expand. And I know that you have a lot ahead of you. I mean, there's so much impact that you can have within the United States. And I'm sure this is not the only country that has something like this where people are struggling to pay off medical debt. I mean, you have some countries that a lot of the medical debt or medical expenses are covered by the government, but there are some where it's not the case. So I can definitely see you guys expanding to an international program, which is, awesome. For anyone who's like, this is me, I need to know more about this organization. I need to file and see if I qualify. Can you give again, like where they can find you and some of the websites that you have?
Yeah, so dollar4.org, our website, if you go to dollar4.org/help, that goes directly to our eligibility screener. And it's 5 questions to see if you're eligible. There's no harm in trying. A lot of people think, this might not be for me, or I probably make too much money. Check it out, try it. There's no harm in seeing. And, you mentioned before we started recording, like this impacts the elimination of medical debt is great. But what that unlocks for people, being able to invest, being able to buy a home, being able to get a loan. A lot of people's credit scores are ruined because of unpaid hospital bills. You know, being able to further their education. We've had people say, hey, I got this medical bill and I'm in my last semester at school and I have to make the decision between am I going to pay a hospital bill or am I going to continue my education? And that shouldn't be the case. A lot of people, they'll cut back on food expenses or whatever. It's like a medical bill shouldn't get in the way of your education, your housing, putting food on the table. You shouldn't lose everything because you get sick. So that's our focus, to be able to eliminate that medical debt so that that can unlock a lot more for people with their financial health.
Amen to that. Yeah, no, thanks again for all your help. And if you're listening to this episode and you have a podcast, or if you have a platform where you can reach a good amount of people and you can share this with the masses, let's create a domino effect. So my challenge to you is get Jared on your podcast, talk about the nonprofit on your page, whatever it might be. If you are an executive or a senior manager at a firm or whatever it might be, I need people to know more about this nonprofit and what they're doing and how people can remove medical debt. So that's my challenge to you. But Jared, I appreciate your time. I appreciate your effort. I appreciate everything you're doing. And again, you're changing lives one after one, dollar after dollar. So guys, $4, FOR, check them out. And with that, thank you guys for coming on to the Betterwallet Podcast and listening to another episode. And Jared, thank you for your time.
Thank you so much. Appreciate you.
Thanks for tuning in to the Betterwallet Podcast. Make sure you subscribe to the show wherever you listen to podcasts. And if you found any value, we'd appreciate a rating and review.